Because I could have something on the floor.
Well, that would be some freaking genius.
Alright, here. God, this is high quality. So, here's my S-bar sheet. Nothing on it, it's just a bunch of S-bar sheets. Nothing on the back. So, I'll be using a thermometer, alcohol swabs, hand sanitizer, blood pressure cuff, and a stethoscope. Alright. You ready? Hello, Mr. Fuller. My name is Nurse Gambrell, student Nurse Gambrell. I'm going to be taking a general survey today on you as well as getting your vital signs, okay?
Yeah.
Can I go ahead and get some identification on you?
Yeah.
Thank you. Name?
Cameron Fuller,
Date of birth?
062700.
Perfect. Thank you. Okay, first I'm going to be asking you some general questions to go ahead and just get something on our charts for you, okay?
Okay.
Height and weight?
6 foot 182.
Any pain recently of any kind?
No pain.
Fever recently?
No fever.
Allergies?
None.
Any health problems recently I need to know about?
Mm-mm.
Okay, perfect. Okay. So next I'm going to dig a little bit deeper. These questions just kind of give me a baseline for what your vital signs might be like, okay?
Okay.
So do you have an abnormal radial pulse normally?
No.
Have you had any fluctuations in your height and weight?
No.
Do you have an abnormal respiratory rate of some sort?
Mm-mm.
Any pain recently?
No pain.
Any fever?
No
Any
fever.
abnormal fevers recently? When was the last time you had your blood pressure taken, and by who, and what was it?
It was about a month ago, and it was like 124/74, I think, and it was by like a nurse practitioner.
Perfect. Okay. Do you have any questions about anything I've asked you so far?
No.
Perfect. Okay, next I'm going to ask you some questions about your family health history.
Mm-hmm.
Do you have a family health history of hypertension, which is high blood pressure?
No.
Do you have any abnormal metabolic growth problems at all in your
No.
family? Do you have any abnormal health problems you need to let me know about in your
No.
family? Perfect. Do you have any, or so next I'm going to ask you some questions about your lifestyle, okay?
Okay.
Just kind of give me an idea of some things that might fluctuate when it comes to your vital signs, okay?
Okay.
So do you drink
No.
any alcohol? And do you use any tobacco products?
Mm-mm.
Any illicit drugs?
No.
You have a special diet of some sort?
No.
Do you exercise often?
Yeah, like 5 times a week, and it's like mostly weightlifting with some cardio.
Perfect. Okay. So next I'm going to be observing his posture. His posture looks good. I'm checking his skin for lesions and contusions. His hygiene looks good. His facial expressions are good, and he's very conscious. He's answering all my questions very well. Yeah, so no problems with observation at all. Okay, so next I'm going to get started on your vital signs. I'm going to start with taking your temperature. Do you have any questions about anything so far?
No.
Perfect. All right. Have you eaten or drinking anything in the last 30 minutes?
No.
Okay, go ahead and lift your tongue up for me. Thank you. $97.5. Is it usually normal for you?
Yes.
Okay, that's normal. Perfect. so next I'm going to be taking your radial pulse. Can you go ahead and put your hand out for me like this? Thank you. And start. Okay, your radial pulse is 73, which is good. Okay, next I am going to be taking your respiratory rate. So just breathe normally. I'll let you know when I'm observing, and I'll be starting in 5, 4, 3, 2, 1. Okay. So respiratory rate is 13. Which is good. While I was taking his respiratory rate, I was observing his accessory muscles to see if he was using any accessory muscles, and he wasn't. His breathing, from what I could hear, sounded good. No abnormalities there. He was breathing fine, and this is normal temperature. Okay, sir. Next, I'm going to be taking your blood pressure. Can you go ahead and sit back here for me? Have your back properly against here. Yeah. Take your hand out like this for me. And what'd you say your normal temperature or blood pressure usually is?
Like 124, I think over 74.
Okay, perfect. Okay. Can you? Perfect. Okay. 125 over 76, which is good. Go ahead and sit back up for me. Okay. So the S bar would be hello, my name is Nurse Gambrell. I am with patient Fuller. We're in room 3535. Today I was taking a general survey and doing vital signs on Mr. Fuller. There was no problems with his vital signs or any of his information, background. So his his temperature is 97.5. He's 6 foot, 182 pounds. Radial pulse of 73, respiratory rate of 13, and blood pressure was 125 over 76. So everything seemed good. That was my assessment is that there's no problems with Mr. Fuller. From what I can see, all his vital signs were good. His general survey didn't have any abnormalities. No pain, no fever, no allergies, no problems whatsoever. I would recommend maybe doing some labs to see if there was anything that I couldn't tell from my observations, but anything else besides that, I wouldn't recommend anything else. That's it.